One thing I get asked all the time is, are there natural treatments for glaucoma? And other than the medications that we have available that you would get from your doctor or in a pharmacy, there aren't really good natural treatments. In the 70s, there was a big study that was done to see whether or not marijuana helped control glaucoma. And what we found is that over long periods of time and the dosage that's required does not help to treat glaucoma, to prevent it from causing blindness. So really the best treatment options that we have are medicines that you'll use, lasers, and then of course surgery. So another question I get asked often is, can eye pressure be reduced without medication? Diet and exercise, things like that. All that helps, but it's not going to reduce your eye pressure. The options that we have for treatment are taking medications daily or doing procedures in the office to help lower the pressure. But without that, it's not really going to control glaucoma in the long term. So how effective are eye drops in treating glaucoma? When used correctly, meaning every single day at the same time, more or less, eye drops can be extremely effective in preventing glaucoma from progressing. So people can be on eye drops for 30, 40, 50 years and glaucoma stays stable, which is pretty amazing. So when I start a person on glaucoma treatment, one of the most common questions is, what are the side effects of the medication that I'm going to be using? And since we have about 8 different kinds of medications or drops that we can use to treat glaucoma, each one does have some side effects. People will typically say that maybe it stings a little bit when they first put it in, or it burns, their eyes look a little bit red, but usually that goes away within a few seconds. And there are things that you can do to help prevent that, like putting your eye drops in the refrigerator or using artificial tears without preservatives throughout the day to keep your eye more lubricated. Often that helps. There are many different types of eye drops that you might get placed on to treat glaucoma, and all of them work on different parts of the pressure system, and your doctor will figure out what's best for you based on your anatomy, the type of glaucoma you have, and maybe even other medications that you're on to make sure that you're being treated appropriately. So if you're started on glaucoma medication, you might wonder, is it going to start working right away or does it take time? Many of the medicines will work immediately and we'll see a quick pressure drop and then the pressure lowers and stabilizes. Some drops that we put you on take a little bit longer to work. So typically if I start someone in an eye drop, I'll have them come back 3 or 4 weeks later to make sure that the pressure is lowered, stabilized, and also that you're not having any side effects from the medication. If you're diagnosed with glaucoma, you may be started on a glaucoma medication, which is typically an eye drop that you're going to use every single day, potentially for the rest of your life. The better you are with taking your medicine, the better controlled your glaucoma will be. So it will prevent you from losing more vision. But nowadays we have so many other treatments in the office that we can do. So if you don't want to use eye drops, we can place medicine in the eye, or I can do a procedure with a laser light that's totally painless that will lower your pressure. We have surgeries available. So it doesn't mean you have to be on drops forever, but typically when you're started, that's the plan. Does laser surgery completely cure glaucoma? It does not cure glaucoma, but it prevents it from progressing. So we have different kinds of lasers that we can use for glaucoma. One is called a Selective Laser Trabeculoplasty, or an SLT. And if an SLT works, on average it lasts for about 5 years to lower and stabilize a person's pressure. It can be repeated 3, even 4 times. So potentially that's 15 to 20 years without needing to use eye drops. So it's really amazing if that's what you choose to do.